Hi, Bio4, and welcome to part 3 of respiratory. We're moving on to the pharynx with a little more detail. So we said that the area from the internal nares to the larynx is going to be the region of the pharynx. So let's not get those two confused. And then we said also that it's shared between the respiratory and the digestive system. So both air and bagel are going down the same tube, essentially. But let's look at the three different regions there. And this is a really nice drawing that shows those regions. You can see that air coming in through the nostrils is going to hit the back of this tube here. That's the nasopharynx. If I were to breathe air in through the mouth, that would be the oropharynx. And then lower than that is the laryngopharynx. And laryngopharynx is a region of these cartilages that we call the larynx. So here it's kind of larynx pharynx, right? But we call it the laryngopharynx. So three separate areas. Remember, they're one tube that is going to allow food or air coming into it. And then after that, we're going to have to separate into esophagus and trachea. So let's a little bit more about the nasopharynx. Eustachian tubes empty into it, and it contains the pharyngeal tonsils, right? So let's go back there. Actually, let me show you the other drawing better. So this is, right, coming from the nose, coming in so you can actually swallow excess fluid that's in the ear, coming in from the ear. And then up here are the pharyngeal tonsils, or the adenoids, very up high. These are not the ones usually that people get removed more frequently. It's these here that are removed more frequently. Okay, so adenoids, if you had to say what's in the region of the nasopharynx, the adenoids, and also the connection with the ear. Okay, in the oropharynx then, it contains the palatine and the lingual tonsils. So remember that these are just your regions of where your antibodies are going to be in response to disease. This is an incoming area to the body, so you want to load up with your immune system right there and ready to attack if there's sort of incoming bacteria, for example. And the laryngopharynx is where respiratory and digestive systems diverge. So back to oropharynx, let's go back there. And then if it's oro, it's behind the mouth, and here are the tonsils. See if I can see the lingual tonsil here. I can't. Okay. Laryngo then is the region of the larynx. So let's look also at the larynx. If you look at it anteriorly, this is what you would see. You would see a lot of cartilage, and then the regular cartilage of the trachea, right? The rings around the trachea. So we want to learn the names of some of these cartilages. And this one, the most common to all of us then, would be the thyroid cartilage here that looks kind of like a butterfly, kind of like butterfly wings. That's the thyroid cartilage. And then coming around here in a ring, sort of at the entrance of the trachea, sort of the most superior part of the trachea, is the cricoid cartilage. And then here is the epiglottis. And the epiglottis, remember, is the piece of cartilage that is going to close off the entry to the trachea when you swallow. Okay, those are all visible in anterior view. If we have to define it, we'd say the larynx connects the laryngopharynx to the trachea, and it's formed actually by 9 cartilages, but you don't have to learn all 9. We're going to look at the thyroid, which some people refer to as Adam's apple. The cricoid, that forms a complete ring around the opening of your trachea. Because the other rings, you're going to see later, don't really go all the way around. It's just like a U-ring. And the epiglottis, which is, we're going to call it the trap door. That's not going to allow the bagel into the trachea. And the arytenoid, which is going to be important in moving your vocal cords and making them more taut for a high-pitched sound or less taut for a lower-pitched sound. So that is the arytenoid. Okay, so thyroid, cricoid, epiglottis, and arytenoid. Those are the 4 that you need to know out of the 9. So looking at them again, now individually, there's the thyroid cartilage filled in for you, anterior view, cricoid cartilage, and this is what I was saying, this ring goes all the way around if I looked at it posteriorly. But these rings of the trachea are really not, they're just like a C like this. And in the posterior end, it's opened because the esophagus is back there, and you don't want the tracheal rings to be upsetting the bagel that's trying to get swallowed. All right, cricoid, epiglottis that you see superiorly above the hyoid bone. And this is a good picture of the position of the epiglottis when you're breathing. So when you're breathing, air is going to come in to the trachea, right? It's going to just keep doing this. And this would be the esophagus. Now what you want to do is put the lid on this here and close it off, like in this diagram here. Close it off, and then when you swallow that bagel, it's going to go down the esophagus and not come into the trachea. So if you do this right now, put your finger on your, Adam's apple and swallow and see what it does. So you can feel it going up, right? So what it does is it first goes up and then curves it down again. So it's up and around, and that's what's going to put the lid on the trachea. Excellent. Now you can swallow and not choke. So usually people choke when they're laughing and swallowing. So they're bringing air in here because they're laughing and they're trying to swallow at the same time. Bad recipe. Not a good thing. Okay, the arytenoid we're going to see in posterior view of the larynx, so of all these cartilages. And it is this region here, not of the very tip, but this region is the arytenoid cartilage. I'll tell you more about it. And there's a cricoid that went all the way around. And here are the rings of the trachea that do not go all the way around because the esophagus is lying here. And you want food to be able to go down without going thud, thud, thud as it goes past the rings of the trachea. Okay. Making sound has to do with the arytenoid cartilage. So this arytenoid cartilage here, look at the position. It is closed in on itself, as the arrow is showing, and it's making this muscle here. It's moving this muscle so that these vocal cords are very taut. You can only realize the difference when I show you the other slide. Look at this. So here, the arytenoid cartilage now is opened more laterally, and the vocal cord here is more relaxed. So let me go back. Taut, high pitch, more relaxed, low pitch. And this is how we control sound, how we sing, right? Now, if you were to put the muscles on there, this is what it would look like. So epiglottis, this is kind of a weird picture, but the cartilage is under here. And these would be the vocal cords. Okay, taut. And this is the abduction of the vocal cords, so it's open and you make a deeper sound. And there's that cartilage that's moving those vocal cords laterally. And this is a clicker. The region colored in yellow is what? I'm not going to tell you. You have to figure it out. Okay, we're going to cut there on that clicker and continue on in the next short video. Thank you. Bye.